I want to welcome you all to this press conference. I'm Susan Buckbinder. I'm a member of the Getting to Zero Steering Committee and director of Bridge HIV, which is a research unit in the San Francisco Department of Public Health. And on behalf of Barbara Garcia, the director of Public Health, and the entire Getting to Zero Consortium, I want to welcome you here to talk about the 3 goals of Getting to Zero. And those are 0 new infections, 0 preventable deaths among people living with HIV, and 0 stigma and discrimination against HIV. Now, we have these goals for San Francisco, and we believe that we can get there because of tremendous breakthroughs in both prevention and treatment over the last several years. And by bringing these together, we think that we can actually achieve what seemed impossible just a few years ago. So what we're doing is we're launching our 3 first initiatives to take advantage of these breakthroughs. The first is citywide expansion of pre-exposure prophylaxis, or PrEP. That's taking a daily pill to prevent new infections. Rapid, which is getting people on the day of diagnosis into care with treatment and wraparound services, comprehensive medical and social services on the same day as diagnosis. And the last is retention, which is keeping everyone who's living with HIV connected with care. And what I want to say is that the way we'll get to zero is to get everyone to zero. And that means that we need to reach into our most vulnerable communities, those who may be suffering from the greatest amount of stigma and discrimination and have structural barriers to accessing these great breakthroughs in HIV. And we think that by doing that, we actually can get to zero. And so I'm here today to introduce several speakers who are going to talk about a very exciting public-private partnership. And I'm going to begin by introducing Mayor Ed Lee, who's been a stalwart supporter of all of our HIV and AIDS work over the last many years, and also the first large donor to the Getting to Zero effort by allocating an additional $1.1 million this year to our efforts. Mayor Lee?
Thank you, Dr. Buckbinder, and again, I want to say thank you to you, to our public health department, to our incredible relationship with UCSF, and to say an extraordinary appreciation for the work that you've done for many years, but also the work that the entire staff does to not only prevent AIDS, but also work with us to make sure that we put the science in front of everybody, and we are guided by that. As much as I would like to take total credit for that budget, I have 2 supervisors who have been in my office many a times to make sure that we are all on the same page. And I just want to say again and appreciate Supervisor Weiner and Supervisor Campos for always working with me very closely when it comes to everything from the cuts in federal government to what we need to do to get educated about approaches like using PrEP, and to make sure that we do all the things that Dr. Buckbinder has suggested that we do as a city, because that is our model, and it's become the national model, if not the world's model, for how to approach and end AIDS. And as the doctor said, I am committed, and so is our board, and we are all together as a city, but we have tremendous partnerships, and I want to also thank the community-based health organizations that are represented here. They're just incredible. They represent the diversity of the city that is our strength, but they also represent the way in which we do it, the way in which we communicate in different languages without bias, welcoming in our transgender population, our LGBT population, people from all over the world who might be experiencing and being victimized by AIDS and HIV. We are a welcoming city, and a city where we don't build walls around the communication we have to have, and we allow ourselves to understand the science approach to this. And that's why we're here today, and also here today to say we're at an incredible and astonishing time in our city, a time when we can see some answers beginning to happen in an epidemic that has plagued our city for so many years. Of course, we were a city where HIV started and was discovered, and it reached epidemic levels, but we're also, since that time, have become a city at the forefront of the appropriate response. And we couldn't do it without the community-based organizations. We couldn't do it without a great institution like our public health department, working with UCSF and all of the bio-life science partners that we have. And we signaled to our LGBT community that their activism was also to be a part of this, that we were not going to deny them or be afraid or shunt. We were going to welcome them in to the kind of levels of services that they needed. This is what we do in San Francisco, and we know now that it is a model not only recognized by many other cities, but we suggest that this has been a model for the United Nations to also suggest to other countries that are facing the same epidemic. Our city will never turn our backs on those that are affected by HIV and AIDS, and we've made that commitment very clearly to our community partners and to the rest of the world. And that's why we have funded our HIV prevention and care to the tune of $54 million of HIV prevention and care for the next year. And we'll continue to do that. And we'll continue to fight for the money that we deserve. But if Congress cannot act on it, we will backfill that because we know it's absolutely necessary. And that's also why I was willing to sign in support with our Board of Supervisors, the United Nations, Getting to Zero initiative as well, because we want to have zero infections. We want to have zero deaths. We certainly want to have zero stigma, perhaps earlier than 2030. And this declaration just simply demonstrates our commitment to doing so, and we're glad to do it, but we're also going to back it up with serious money. In addition to that, we have included actually $1.2 million, Susan, in new money for Getting to Zero initiative. And I know that this is an incredible signal, again, that Getting to Zero is important, very important to the city. But as I said today, we have partners that know that if we take a step forward, they're going to take a step forward. And whether it's the community-based organizations or our partners at UCSF, we are also always welcoming additional partners. And today is to announce that MAC AIDS Foundation is generously supporting our Getting to Zero initiative with over $500,000 in donation to this cause. And that's going to be added to the $1.2 million. So we're finding partners. This is incredible. This is an incredible announcement. I did tell Nancy and Karen, it's great because at my house with the wife and kids, all I see is Mac stuff. And so we're part of that. We're part of that effort here. But I just say just a deep thanks on behalf of the city that we have, yet again, another partner to step up. And I know with them, there'll be even more that will be paying attention to this because we all want to get to zero. And this zero cause is going to guide us. It's going to be our mantra, but it'll be the rallying cry that we can, in our lifetimes, end this epidemic for everyone. And we want to do so because this is San Francisco, and this is what we do. This is why we came here. This is why we live here. And we want to celebrate with all of our partners and those that are experiencing this to say that you have a rich life in San Francisco to be gained by following this and by working with us. So I say today that it's an incredible thank you on behalf of the city, and also to say that we as a city will continue this wonderful effort that we have, continue the dialogue, but Getting to Zero is going to be the guidance, and it will be the science, but we'll do it in a way in which we honor the incredible diversity that's our strength in our city. Thank you for being here.
Thank you so much, Mayor Lee. And now I'd like to introduce Supervisor Scott Weiner from District 8, who has been with the Getting to Zero Consortium from its inception.
Thank you very much. While I don't use Mac products, I am, thank you, always. I am just deeply appreciative of this contribution to our Getting to Zero consortium and to this effort to once and for all end just eliminate new HIV infections and HIV deaths in San Francisco, and then to do what San Francisco has always done when it comes to public health, to pioneer it here and then to export it to the country and to the world so we can end HIV infections throughout the world, period, end of story. And Mr. Mayor, I want to thank you for your strong support for these efforts. I came of age as a gay man in 1987 when it was a pretty scary time where there was no real treatment for this disease, where people were dying left and right, and it was a tough time to come into the community as a young 17-year-old gay man. And I came to San Francisco in 1997, and I've lived in the Castro for almost 20 years, but I came here when we were just starting to see effective treatments come onto the scene and people were starting to get healthy again. It was really terrific. And over time, we made so much progress. This is a disease where we have played defense for many, many, many years, just trying to keep people alive, trying to get people healthy, trying to backfill draconian federal HIV cuts through our city budget because Congress couldn't get it together, and because Nancy Pelosi, after so many years of heroic efforts, finally that right-wing wave overcame our own HIV funding. And thank you, Mr. Mayor, and thank you, Supervisor Campos, for all of us working together to backfill nearly $30 million in federal HIV cuts. But we've been playing defense, and we're now playing offense. We are now moving forward, and we are doing so well in our Getting to Zero effort. Since the early 90s, we have reduced HIV deaths in San Francisco by about 90%. We have, since the early 1990s, reduced new HIV infections by almost 90%, from over 2,000 to last year, 302 infections. And while that is 302 too many, it is a significant reduction. And with this effort, combining quick testing, regular testing, having people know their status, and we know that over 90% of HIV positive people in San Francisco know their status, immediate access to treatment, viral suppression, and then strong access to all prevention tools, including pre-exposure prophylaxis, and making sure that people can actually afford PrEP, we can actually do this and get it done. So this is an exciting step forward. We've always had a wonderful partnership between our city and our business community and our community-based organizations, all working together, and we're just very, very grateful for the Foundation's support of this effort. Thank you.
And now I'd like to introduce Supervisor Campos from District 9, who's also been a part of the Getting to Zero Consortium since its beginning.
Thank you. What an exciting day. Thank you, Mr. Mayor. Thank you, Supervisor Weiner. Thank you to everyone who's here. When we talked about doing a budget supplemental last year to specifically target making PrEP available to anyone who wants it in San Francisco, the idea behind that is, San Francisco has never been afraid to be the first to do many things. And San Francisco has been a sanctuary when it comes to things like immigration, when it comes to things like medical cannabis. And this is about San Francisco becoming a sanctuary from HIV infection. We want to be the first city in not just the country, but in the world to be able to do that. And for that to happen, the reality is that we're all connected. And we will be able to do that and will be successful only if we are able to target the most vulnerable among us. And that's the challenge that we have when it comes to HIV infection. I believe that the city is capable of doing that. I want to thank Mac, and I do use your product, so thank you for the... I expect, some sort of... fee for that. I don't know. You can give it to one of the organizations here. I think that we can do it. If anyone can do it, San Francisco can do it. And I want to provide some context, and I want to end with this because, and it's not a negative note. I think it's simply remembering how far we've come, because the thing that comes to mind as we're here talking about this very exciting prospect is all the friends that we've lost that couldn't live to see this day. So and all of us have someone like that. And so to the memory of my friend Michael Goldstein and everyone who died from this epidemic, if I may ask you for a moment of silence to remember them, and in that memory, rededicate ourselves to this effort. Thank you very much.
Thank you, Supervisor Campos. And now it's my pleasure to introduce Dr. Diane Hagler, who is the chief of the UCSF HIV/AIDS program at San Francisco General Hospital, who actually was providing care for patients living with HIV from the very beginning of the epidemic in San Francisco.
Thank you, Susan. The Getting to Zero movement in San Francisco started in 2013 at a World AIDS Day forum we hosted at the LGBT Center. After a series of panelists described recent scientific advances and innovative programs happening in our city, one of the community members in the front row raised his hand and he said, "Well, this is all interesting, but are you all working together?" And there was a moment of silence, and that was our call to action. And 3 months later, we had pulled together an all-city consortium with the Department of Public Health, our political leaders, UCSF, the private sector, Kaiser, people living with HIV, our leading community organizations, and set our priorities that Susan put forth for getting to zero in San Francisco, 90% reductions of HIV infections by 2020, and our 3 priorities. Let me tell you about one of the innovations developed by UCSF folks happening at my hospital at San Francisco General. One of the things that we realized was that people were falling out of care between the time they were HIV tested and the time they had the opportunity to start therapy. The testing in the community, the care, of course, is at the care centers. Well, we did something very practical. What we did was we called a taxi for people after they had a test or an Uber or transportation, and we welcomed them to our clinic the very same day that they had got their HIV result. We engaged them in care, we continued counseling, we worked through insurance issues, and we offered them to start life-saving therapy that very day. Well, just like in 2010, where there was some resistance when we in San Francisco were the first city in the entire world to offer treatment for everyone living with HIV, there was a little resistance to the program. But with our experience now, we know that it's working. And what we know is that the time to viral suppression from a detectable virus to undetectable, we've cut in half with this new program. That's good for the patient, the person living with HIV, and that also reduces transmission. Plus, this can provide a tremendous relief for the person living with HIV, and it also can help with disclosure. Let me share with you a story from one of our patients who was telling his mother about his new diagnosis. What he said to her, "Mom, I have HIV, but don't worry, I'll be okay. I started treatment today." So right now, we'd like to acknowledge the Getting to Zero movement, to thank all of our sponsors, the mayor, the supervisors, to Matt Gates, who's focusing on retention, to allow us to expand first in the world innovative programs like RAPID in our city and around the world. We've already had visitors from Amsterdam and Paris wanting to know about this new program. So, in conclusion, we've made a lot of progress in San Francisco, but it's not over. And with these strategic investments that you've heard about today, we are convinced that by working together with a multi-sector group of people in the community, San Francisco style, we will be the first jurisdiction to get to zero. Thank you.
Thank you, Diane. And now it's my pleasure to introduce the MAC Cosmetics Global Brand President, Karen Buglisi-Weiler.
Good morning, everybody, and thank you to the City of San Francisco, and thank you, Mr. Mayor, for allowing us to partner. You know, when I think about HIV and AIDS, it's been a fight that we've had since the very beginning of MAC. When our founders, Frank Toscan and Frank Angelo, saw their friends dying over 20 years ago, and they said, "What can we do?" we know how to do lipstick. So that's when Viva Glam, the concept of Viva Glam was born. And this is a 100% giving model that went to a fund called the MAC AIDS Fund. And with the power of celebrity, and if you remember, RuPaul was the first celebrity. Do we all remember RuPaul? Who could bring awareness. That was the concept of our fight against HIV and AIDS, which we still honor today. Our last spokesperson, our current spokesperson, is Miley Cyrus, and what they do is they give us the power to reach millions of people around the world. And you talk about underserved communities, that's what we're about. The MAC brand is about all ages, all races, all sexes, all inclusive. The MAC AIDS Fund is about serving communities that are all ages, all races, all sexes, all inclusive. And when you think about that, we can do that with the power of this lipstick. And I'm so proud that we have our San Francisco leadership team here, because it's really the staff that makes this work. We have 19,000 artists around the world that sell Viva Glam every single day, and what we say at MAC is, you sell a lipstick, you can save a life. So we want to save a lot of lives. And we want to eradicate this disease as much as you do. And we're going to challenge every city in the United States and every city around the world to give us the challenge so we can bring this grant to you. Let's get rid of AIDS. Let's get rid of HIV. That's what we say. Thank you.
Thank you so much. And now I'm going to introduce Nancy Mann, who is the Global Executive Director of the MAC AIDS Fund.
Thank you, Susan. I started my career a long time ago actually working in San Francisco, and I think that if we had ever thought about what would be the first city in the United States to end AIDS, I don't think anybody would have picked San Francisco. So go Frisco. In my night job, I'm head of the Presidential Council on AIDS, and I know that partnerships are difficult, right? You have basically this incredible partnership of, the fact that the mayor and so many supervisors and UCSF are willing to be here shows how much skin the city has in the game. You have a very diverse epidemic, IV drug users, MSM, and people have gotten out of their work streams, they've gotten out of the way that they think, and essentially what they've done is bring good retail to healthcare. We spend a lot of time as a cosmetic company thinking why people walk into our store and walk out. And what you all have done is the exact same thing. How do we keep people in the AIDS treatment, the AIDS testing store? I do also want to acknowledge the MAC makeup artists who day in and day out really, we've raised almost $43 million this year. That's a lot of lipstick. And really, it is very profound. The city of San Francisco really understands that a city is only as healthy as its sickest citizen. And that's going to be true in every town. And the way that we're going to end this epidemic really is through the leadership of San Francisco. So it is an honor. Thank you again, Mr. Mayor, and particularly for backfilling all of those federal funds. We fight hard, but sometimes we lose. And what we would love to do also is invite more funders, more people to fund this incredible effort, and more people to end the effort in every city. Thank you.
Thank you so much. Our next speaker is James LaDuke, who's the Vice President for Philanthropy and Public Affairs for the San Francisco AIDS Foundation.
Thank you. Good morning, everyone. We have a saying at San Francisco AIDS Foundation, you can always tell when Mac's in the house because they're always the most glamorous people in the room. But the one thing that can't be overlooked is so often they're also the most passionate and the most committed to the cause in the room. And so I just want to take a moment and give another huge hand to both the local folks from MAC and MAC Corporate. For 3 decades, our city's name has been synonymous with a model of care that today is renowned around the world. And thanks to groundbreaking initiatives like Getting to Zero, San Francisco is once again setting the pace for the rest of the nation. Soon, we'll become the first city to end HIV transmissions, AIDS-related deaths, and HIV-related stigma. Getting to Zero represents the natural evolution of what we've proved time and time again here in San Francisco. That innovation is fundamental, but innovation alone doesn't get the job done. Progress also requires commitment, collaboration, and community action. It requires a plan. And Getting to Zero is that plan for San Francisco. San Francisco AIDS Foundation is very proud to play a major role in this plan. Soon, the foundation will open the doors of a new center in the Castro called Strut, marking a new era in how we approach HIV by promoting health and wellness and celebrating people for who they are and how they love. We created Strut because we believe it's far time to treat gay, bi, and trans men as whole people, not as a collection of risk factors. I'd like to take a moment especially to thank Mayor Lee and Supervisor Scott Weiner for being major early champions of our groundbreaking clinical facility. Thanks to their support, they secured $1.5 million in public funding during its early critical phase. Thank you both. And I'm also very proud to announce for the very first time a gift, an additional gift from MacAIDS Fund of $100,000 to expand access to PrEP and PEP at Strut. And thanks to their support, Strut will feature what will be the largest PrEP clinic in the city, if not the entire world. Thank you. Together with major advancements driven by Getting to Zero initiative, we are more confident than ever that we'll soon be able to add ending HIV transmission to the long list of things that can be accomplished when San Franciscans come together. Thank you.
Thank you, James. And James is also a member of the Getting to Zero Steering Committee, as is Lance Toma, who is the Executive Director of the API Wellness Center, and will speak next.
Good morning. You know, this is such an incredible moment in the HIV epidemic where we can all stand here today and not just dream about a moment where we will have no new HIV infections, no HIV deaths, and no stigma. We don't have to dream about it. We can actually stand here and say confidently that this will happen. You know, we will realize this, and I just can't thank Mayor Lee, the Board of Supervisors, Supervisor Weiner, Supervisor Campos, and MacAIDS Fund for your support, tremendous investment in this. I participate on the steering committee of Getting to Zero because we're a community here in San Francisco that has invested strategically in developing a model of care and prevention that's incredible, and it's a result of years and years of hard work. I'm also the co-chair of the HIV/AIDS Providers Network here in San Francisco. HAPPN is the network of over 30 HIV/AIDS service and support organizations. We provide medical care, case management, behavioral, mental health, substance abuse, food, employment services, legal, housing support, wraparound services for folks living with HIV. And we work hand in hand with the city, our mayor, our board of supervisors to ensure that this safety net has remained intact and is unbroken despite major reductions, as you have heard, in federal funding from the federal government. Our commitment in the city and its leadership is unparalleled across the country. At API Wellness Center, where I work, we have long championed collaboration as a cornerstone of the San Francisco model of HIV care. For over 15 years, we've actually established an enduring partnership with the San Francisco Department of Public Health to provide comprehensive and integrated care for people living with HIV in the Tenderloin neighborhood here in San Francisco. Over 4 years ago, we actually received federal funds to establish a pilot project that focuses on transgender women of color and homeless individuals living with HIV, getting them into care, keeping them into care, and getting them to health, wellness, and undetectable viral loads. And you will hear from one of our mutual clients, Johanna, immediately following me to talk about her story. These projects of national significance are helping some of the city's most vulnerable residents achieve health and wellness. We believe in long-term committed collaborations and effective public health strategies that really rely on and must engage community institutions and resources, like what API Wellness Center and the San Francisco Department of Public Health are doing together. This is a core element of our overall approach here in the city. It contributes to our overall success, and it really allows us to vision and to say that we will end this epidemic and we will get to zero. Thank you.
And it's my great pleasure to introduce Johanna Brown, who's going to talk a little bit about her experience.
Hello, and thank you for having me. Thank you, Melanie. In 1988, I was diagnosed with HIV. By 1995, I found out that I was living with AIDS. At the time, I was working as a nurse. I lost my job. I lost my apartment. I got on drugs real heavy, lost my self-esteem, got disconnected from my family. By 2011, I moved to San Francisco. I joined API. There I met my doctor, my case manager, my therapist. We worked on my self-esteem. They helped me find housing. They helped me get back to work. I'm working again as a nurse. I'm working in the community as an outreach worker. The good part about API is that they open trans access. And that's a program for transgenders. And there, we as girls get to come together, we get to socialize within ourselves, but we get to learn about our disease. We get to learn who we are in this community, living with HIV and AIDS. We get to support each other. We don't have to be worried about being stigmatized, being judged, being people pointing fingers at us. So we live, kind of a healthier life. We build upon ourselves. We go back out into our community stronger and with strength, and we get to find jobs, apartments, and housing. Now today, my viral loads are undetectable. I have a T-cell count over 1,006. But today what I'm here for is for getting to zero. So my call is to all of San Francisco. I think it's important that you add us as trans women, trans men to your community, to this program, so we can also become part of this program, because it's important for us to. Thank you.